Hello, I'm Gwen Eiffel. Welcome to the Washington Week Webcast Extra. I'm joined around the table by Alexis Simendinger of Real Clear Politics, Amy Walter of the Cook Political Report, and Alex Wayne of Bloomberg News. Right up until Secretary Sebelius resigned, this week's big healthcare story was about how many millions of Medicare dollars were going to how few doctors. It turns out it's about dollar signs and perhaps some overcharging too, but also about what our healthcare system is spending its money on, Alex.
This was a very exciting day for health policy reporters and for health nerds nationwide. For the first time ever, Medicare released information on what it pays to more than 800,000 doctors, plus some other people who bill like doctors. And it came to about $77 billion, which is actually not a real huge piece of Medicare spending. The program is $574 billion, and this dates back to 2012. But it was full of all sorts of interesting things about what the doctors do, how they make their money, how they build the program. For example, ophthalmologists wound up being one of the highest paid specialties in the country by Medicare because they give injections of a drug called Lucentis for macular degeneration, right? Of blindness, essentially. Yeah.
But also they found out that a lot of this money actually goes for pharmaceuticals. This is not just doctors pocketing the money. They're almost like a pass-through to
the top two categories are oncologists and ophthalmologists, and essentially both of those specialties are taking this money and paying for the drugs they administer in their offices. But they do get a cut, though.
But isn't this the price of living longer, or is it just that certain doctors know how to game the system more than other doctors do?
On one hand, we are living in an age where we've got very modern advances in medicine, and thank goodness for that. But on the other hand, some of these doctors are using more expensive drugs than they have to. For example, this drug Lucentis. There's a less expensive alternative that works just as better or just as well, according to clinical studies. Doctors don't like to use it. They like to use the brand name Lucentis.
And maybe that's where all the money is being spent. Let's stay with healthcare for a while, because we're about to, as she is confirmed, get a new Secretary of Health and Human Services. Her name is Sylvia Mathews Burwell. A lot of us know her from when she worked in the Clinton administration, and she's been around in and out of government. Who is she now, the head of the Office of Management and Budget? But besides that.
So the president brought in Sylvia Burwell to be OMB director, and he brought her in from the Walmart Foundation, and before that she'd been with the Gates Foundation. So she'd been outside of government. In fact, living in Washington State and in Arkansas. She's from West Virginia. She's 48 years old. She's a graduate of Harvard. She's a Rhodes Scholar.
Underachiever, clearly.
Underachiever, and a mother of two, I might add. And so one of the things that's compelling about Sylvia, as somebody that I've covered since the '92 Clinton campaign when she was in Arkansas, is that she's considered a hyper-organized, wonderful fixer, a person who understands management, whether it's in a small setting or a larger setting. And President Obama has, I think, grown to really appreciate, especially during the shutdown at the Office of Management and Budget, had to manage the shutdown, the government shutdown of 16 days. And he really appreciates that she's a very cheerful and engaging person. She has relationships across the aisle. She was, as we saw, confirmed to OMB, 96 to zip. So there's this idea that you can turn the page for HHS and get someone with all of these attributes at this phase of HHS's history.
I remember Sylvia Mathews from Little Rock, too. Wasn't she in the War Room? Won't you see her pop up in that movie somewhere back in the day?
Who will play her? This is what we want.
Who will play her in the next War Room?
Who will play her in the next, yeah.
I want to see. Amy, I want to ask you you wrote a story this week about why Democrats have to run against the economy, basically, in order to win. But also, you point out, Republicans have to run against something else, each other.
Yes. So if you say that the 2014 election, Democrats' biggest obstacles are the map. We've talked about a lot here how many tough states they have to defend in the Senate, and the mood, which is the economy. People still not feeling good about that, not feeling particularly good about the president's handling of it. For Republicans, they have one big liability, and that is Republicans. And it's usually in the primaries where they have those problems come up. And we saw it in 2010, we saw it in 2012, where the more electable candidate lost a primary to the more exotic candidate who ended up saying or doing not very good things or smart things.
The
Todd Aikens and Richard, exactly. Yeah. And that has kept Democrats in the game. Republicans are working very hard this year to avoid those sorts of mistakes.
How do you do that? How do you stop someone?
So right now what they've been doing is you see the business community, Chamber of Commerce, group like American Crossroads, the Carl Rove Back Group, going in, for example, into North Carolina, a state that they see as a top target, and they are backing the establishment candidate, a guy named Tom Tillis, who's the head of the state Senate there, putting a lot of money behind him. The other two candidates, more Tea Party, don't have the money to compete. We'll see if it works. If it does, they can say, see, we played in a primary, we got the right candidate, we have the right mood.
It sounds like Republicans, there's something they can do. There's a path for them. But for Democrats who are just dealing with the vagaries of the economy, on a week like this when the stock market tanked, it doesn't seem like there's a lot they can do to control their foe.
That's right. And that they are, if you think about how pessimistic Americans are about where the economy is, and I wrote a column about it this week, looking back at CNBC polling taken since the financial crisis. And Americans have become not only more pessimistic about their current economic situation, but they're more pessimistic about the future. They're like how they're going to be in a year. And if you look at the difference between where those groups that Alexis had talked about, that women, minorities, younger voters, they feel much more pessimistic about their economic situation today than they did back in 2012 when the president won with not a great economy. Exactly. And that's why getting those issues up is going to be very important for them.
Amy Walter, Alex Wayne, Alexis Simendinger, thank you all very much. We could go on, but we won't. So you can stay online at pbs.org/Washington Week and read my take on presidents doing big things. And we'll see you next time on the Washington Week Webcast Extra.